what the city is talking about, the news that impacts you. Welcome to the Montreal Now podcast with Aaron Rand and Natasha Hall.
Welcome to the week that was here on the iHeartRadio network. I'm Aaron Rand along with Natasha Hall, and this week we'll take a look at these stories. After a temporary freeze on some food prices, major retailers this week told Canadians to expect prices to keep rising. We'll speak to Dalhousie University's food professor, SYLVAIN to find out why and how long this trend is going to continue.
This week, the World Health Organization announced that COVID-19 is still a global health emergency, and they declined to declare the pandemic is over. We asked Dr. VINH, an infectious disease physician, if he agrees with that decision.
A group of Americans have decided to open a Montreal-themed restaurant in, of all places, Washington, D.C., and it's proving to be a huge hit. We'll talk to the principals about why they did it and what exactly a Montreal-themed restaurant actually is.
But we begin with this. New voluntary standards for long-term care homes in Canada have now been released. And the key word or key concern is that word, voluntary. Will the standards actually be implemented, and do they go far enough? We spoke to the doctor who is chair of the technical committee that drafted the standards.
We talked earlier in the show, actually the lead into our second question of the day today concerns these new suggestions, recommendations that are all voluntary as to how we can make the situation in our long-term care homes in this country better, because God knows they need to be better. We all know just how ravaged these long-term care homes were during the first wave of the pandemic. Federal government said it was going to do something needed to be done. Well, now we have a set of guidelines that have come to the federal government. The question is, are they going to be implemented? Is just the fact that they have them and they're voluntary enough to really change anything? Dr. SAMIR Sinha is Director of Geriatrics at Sinai Health in Toronto. He's also chair of the technical committee that drafted these standards. He's on the line right now. Dr. Sinha, thanks for being here.
Thanks for having me.
I saw you last night talking about this, and, we asked people today. We had a very difficult time here in Quebec, as I'm sure the rest of the country did in our long-term care homes. And I look at some of the recommendations that are in here, and they seem like they make a tremendous amount of sense. But as I said, it seems to me the key word here is voluntary standards, and that is something a lot of people think, great, but will they get adopted, and what do you think?
Well, you're right. I mean, if standards like this, which basically are what 20,000 Canadians helped us to write as a committee, telling us that all these sorts of things are important to creating high-quality long-term care, such as having appropriate settings that are small in nature, allow people to have their own rooms for privacy and dignity, but also for better infection prevention and control, but making sure that we are supporting our staff to provide the care that they need to provide, adequately staffing homes, and then making sure that we focus our care on providing what we call resident-centered care that actually treats residents not like animals, but human beings, and making sure that we're thinking about and asking what do they need, how do they want their care to look like, and that we have clear guidance that really supports quality improvement and provides the leadership these homes need. So these are the standards we have. But as you said, they're practical. We made sure that these are accountable. You can be accountable to them, and that they're reasonable things that we can achieve. But again, if they're just voluntary, they're not going to have that much impact. The good news is places like Quebec have agreed that 100% of their long-term care homes are now going to be accredited against these new standards. But accreditation is only one thing. Accreditation is the home basically being able to prove to external examiners that they're actually adhering to these things and to these guidelines and recommendations. But Quebec also needs to make sure that its enforcement, its inspections programs are also linked to these standards, so that we can make sure that if there are concerns that are arising, that when inspectors or the government goes in, they're making sure that they can actually evaluate, is this home meeting these needs? If we don't do those sorts of things, and if Quebec doesn't fund its long-term care homes properly to provide at least 4 hours of care, we're going to be in a really difficult position to move long-term care forward.
It's nice to hear that Quebec is doing something right, or at least taking a step in the right direction, but it sounds like it just simply doesn't go far enough. And then by comparison, the other provinces aren't even close. Would you, in an ideal world, like to see these standards mandated across the country?
I would. The challenge that the federal government has is, well, they actually finance and support the Crown agency called the Standard Council of Canada that develops all the standards and oversees the development of all the standards we have. The tricky thing about long-term care is that it is a provincial and territorial jurisdiction. So we literally have 13 different versions of long-term care homes across the country, all sorts of different criteria that have arisen, different funding formulas, different mechanisms. So it's hard for the federal government to mandate something that ultimately it doesn't actually directly fund and oversee. This is why we have so many different outcomes that occurred during the pandemic. And why different provinces are taking different approaches. But what we have recommended, for example, is that we need to be providing at least 4 hours of direct care per day. And I was in Denmark last year with our Minister of Health in Quebec, taking him to some of the nursing homes there, some of the leading nursing homes, showing kind of what it actually looks like, and reminding him that, in that home that we were at, where there were 10 residents on a floor, there were 3 full-time staff present at that time, and asking him, how many staff do we actually have in a home? And when he says, we have, 1 staff member for 8 residents. Well, you can't provide care that way. And the people in Denmark were just horrified when they heard that we might even staff a home that way. So the good news is that Ontario, Nova Scotia, Manitoba are all moving towards this 4-hour-a-day mark. I think there's a great opportunity now that Quebec is about to get a lot more money from Ottawa in exchange for accountability measures. They can put that money towards creating 4 hours of care, direct care per day per resident. And they can also use these standards for more than just accreditation, but also tying it to inspections enforcement, because everybody in Quebec, everybody across the country knows our homes didn't do well because we didn't set them up for success. And now we have clear regulations that Quebecers and experts from Quebec contributed towards, key recommendations that, frankly, we know what to do. We just have to do it.
Yeah, well, that's the problem. We talked about this earlier on, right? That whole idea of enforcement, that was the biggest hole in this entire situation, because it's all well and good, to have a list of requirements and guidelines and say we're the ones and we're going to enforce them. And if no one shows up to see that they're being followed, you're pretty much exactly where you are, where you started.
That's exactly it, right? And we saw, I think if we think back to the horrific stories that started to erupt, I remember just weeping when I saw what happened at Maison Héron, and just reading the accounts of the paramedics who said it was like they had entered into a concentration camp. The fact that we could actually even allow something like that to have happened in our own country, or when our military, went into homes in Quebec and Ontario and wrote reports that basically just told us that we were being our own worst enemies. You're absolutely right. We need proper enforcement. We need proper accountability. Those mechanisms do exist, but if they're toothless and they're not tied to these sorts of standards, then we're just going to keep repeating the same mistakes over and over and over. So, we were tasked, through this federal process to develop standards. We were tasked to talk to Canadians. 20,000 of them participated in this process. We actually released our draft standards almost a year ago so that people could review them. We had 3,600 comments. We've never had a standards process in Canadian history that had more public involvement than this one. So, if anybody says, did we miss anything? I'm like, well, when 20,000 people are looking over your shoulder, it's hard to miss anything.
That's great.
Yeah.
But so we have credible ones, but we need to actually enforce these. You're absolutely right.
Well, and enforce,
all
I think about, Doctor, in terms of enforcing is, we have such a lack of staff. Would it be easier to find staff to enforce these standards than it is to find staff to actually work in the long-term care homes?
It's one of those things where people say, well, should we staff the home properly, or should we just find more police officers to see what's going on?
Yeah.
I think people actually want to actually work in long-term care. But the problem is, in many parts of Canada, in publicly funded long-term care homes, you make a lower wage than if you were a nurse in a publicly funded hospital. Yeah. We shouldn't be treating long-term care settings as second-class places to work.
Agreed.
And we shouldn't treat nurses or frontline care assistants as second-class workers. They are first-class workers. They're doing some of the hardest work in healthcare. We should pay them fairly. And we talk a lot in these standards now about how we need to treat staff, how we need to give them whistleblower protections, how we need to encourage full-time work so they don't have to cobble multiple jobs in multiple homes, so homes can save money by giving them only part-time employment. By just treating staff like human beings, you create a healthy and competent workforce. You decrease turnover. You ultimately, as we like to say, the conditions of work are the conditions of care. So I think the key is that if we put money in so that we adequately staff homes, but then again, adhere to these standards about how to treat staff well in these environments. And there's a ton of science to support what we're talking about. You actually get, a really, really different kind of story. And I was really blessed, to be able to, take, the minister and his team, around, one of the best, not even the best, a typical nursing home in Denmark. And, his eyes were, quite open.
I bet.
He was like,
I bet.
This is different. And I want to point out key differences because this is possible. This is not pie in the sky. These aren't lofty recommendations. These are things that we know are practical and doable if we just have the political will to make them happen.
Dr. Sinha, we're going to run out of time. We've got 30 seconds. Tell me where you are in the situation or the idea, because I asked this of our listeners as well, on eliminating private for-profit healthcare, long-term healthcare overall.
We, at the moment, I wouldn't say that we need a radical change in the system. I think we need to make sure that anybody who's participating in it needs to actually be following these standards. And that's the first step. And then after that, we know that private operators don't often deliver the same quality of care on average that public or not-for-profit operators do. But I leave that to the provinces and territories to figure out what they want to do. At first, let's actually just allow everybody to meet these basic standards and then figure out that other part next.
One thing at a time.
Dr. SAMIR SINHA, he is Director of Geriatrics at Sinai Health in Toronto, chair of the committee that drafted all these standards we've been talking about. Dr. SINHA, thank you so much for your time. Very much appreciate it.
Thanks for having me.
Informative, interactive, and always interesting. This is Montreal Now with Aaron Rand and Natasha Hall.
After a temporary freeze on some food prices, major retailers this week told Canadians to expect prices to keep rising. We'll speak to Dalhousie University's food professor, SYLVAIN to find out why and how long this trend is going to continue. We spent a lot of time over the past little while talking about how food prices kept going higher and higher. We heard stories, people calling in as well. Eggs, remember we were talking about lettuce not that long ago, a head of lettuce, $6, $7, $8, wherever you happen to be. I think we all expected then, as time went on, that prices would come back and start to go back to where they're supposed to be, to what we would call normal. Certainly when, interest rates go the other way, we expect that to happen. But even now, it looks like, and I read some of the stories this morning, Loblaws is kind of in the focus here, right? They have a no-name brand, right?
Yes.
Their yellow stuff that you see Galen Weston selling on TV. Well, he went out of his way to say the freeze on prices, because that's what there had been on those no-name brands, is coming to an end.
Yes.
For a lot of people, those brands are the only thing they were buying that they could afford to buy in those stores, and now they're finding out those prices now, they're going up along with everything else.
It's not exclusive to Loblaws and Provigo, right? We heard that Metro did the same thing. They had a price freeze. That is also coming to an end. And not only are the prices going to stop being frozen, they are going up. So it's going to hurt.
We also heard today, this is give you an idea, because a lot of people think the grocery stores, these chains, are the ones making all these exorbitant profits, and they've been doing very well. Part of the announcement today from Loblaws was that 27,000 of their suppliers, these are the people who sell to those stores, are suggesting they're going to need to see a 10% hike in what they're getting paid.
I mean, fair enough, but you kind of think it's a bit of a passing the buck, right? Don't blame us, it's them.
27,000 suppliers.
Yikes.
That's a lot of people. SYLVAIN CHARLEBOIS, Senior Director of Agri-Food Analytics. He's over at Dalhousie University. He's our food professor we chat with every now and then. SYLVAIN, listen, was it unrealistic to think that prices, which have gone up and up and up, would finally start to come down this soon?
I'll rephrase that. I don't think food prices will ever come down. 2022 really created this. I think this is something that is underappreciated by a lot of people. 2022 created new cost benchmarks across the board. Salaries have gone up, packaging fees, freight costs, like everything has gone up. And because we're looking at a global phenomena, nobody is immune to what's going on around the world. I mean, Canada still has one of the lowest food inflation rates in the world, but people keep on blaming Galen Weston and Loblaw. It's a bit ridiculous.
All right, but look, I just want to go back to something that we had talked about at the beginning. We heard about supply chain issues. They were a problem. I thought that situation was beginning to regulate itself now. Why are we in a new paradigm as far as you're concerned?
It's just because things got way more complicated across the board. The thing about food distribution is that risks don't go away; they move, and risks tend to cost money. Whether it's climate change related, Ukraine, geopolitics, you name it, things are pretty shaky right now. They've been shaky for a while. The pandemic itself really made supply chains resilient. Things are improving, of course, but they're not at 100%. Labor is also a big issue everywhere around the world. So whenever you need to do something, you have to do these things with fewer people, which slows things down. And when you slow things down, it tends to cost more. And so right now, we're hurting as consumers because of a high food inflation rate at retail. But it's even worse within the supply chain because there's a lot of tension between suppliers and grocers. Look at what happened yesterday between PepsiCo and Loblaw. There was a memo that was leaked telling everyone that Pepsi is charging more for its chips. That memo was leaked by a grocer. So there's a lot of blaming going on right now, and the people caught in the middle are consumers.
Well, I was thinking we'd all have a much easier time stomaching these prices if we didn't think or know that those companies were making huge profits, right? I mean, I think that's where it really starts to smell bad. Again,
let me rephrase. I encourage you and your listeners to look at Loblaw's financial statements. Same for Empire, same for Metro. When you actually look at the numbers, yes, dollar figures are very high, okay? When you look at the 6-year average, they're above average, way above average. But when you look at food sales in general, they're below the food inflation rate. So Loblaw, for example, last quarter, their food sales increased by 6.8%.
Okay.
That's way below the food inflation rate of 10.3%. So they're making money selling lipsticks and T-shirts. If that's wrong, then that's wrong. But they're actually not making a whole lot of money selling food. That's why there's a lot of confusion out there. Everyone's saying companies are making too much money. Well, they're making money, not necessarily selling food.
Yeah, that's an interesting point. I just wonder, though, that being the case, who is making that money, or is nobody making that money selling food?
I have concerns. I have concerns up the food chain in processing with certain verticals. Now, I would start with dairy. I mean, yesterday, dairy milk prices at Farmgate increased by 2.2%. No one at the Canadian Dairy Commission should explain why that 2.2% was applied to milk prices at Farmgate. They said, well, it's costing more to feed cows and things like that. Well, how much more? They actually did survey over 200 farmers to basically quantify that increase. Can we see that data? They've always refused. Meat packing is another one. If you go to the meat counter, beef prices are going up, but farmers are getting less. Why is that? It's not necessarily because of the grocer. Something's going on in meat packing.
You know, people have said, to Natasha's point about profits, and I'm glad you kind of reframed it to give people an idea what's going on. We've heard we need to have an investigation of big major retailers here. The way you're laying it out, there should be an investigation, but not of them, of the people in between here trying to figure out where this money is going. Do you agree that that should happen?
Of course. On December 5th, I was asked to testify before Parliament in regards to their food inflation investigation. I had MPs in front of me and did say exactly what you just said. Let's look at the entire value chain, and you should call and ask the Competition Bureau and Statistics Canada to witness as well. And that's what I've recommended to the committee. Basically, pointing fingers at grocers alone would be to simplify a very complex issue. And again, I'm going to go back to my point about world markets. There's a lot of pressure on Canada coming from abroad. Inflation is not because of grocers and companies here in Canada. Inflation is impacted by what goes on outside of our borders as well.
Sure. Yeah, and that includes a war. Let's bring it back to the average consumer for a moment, Sylvain, before we run out of time here. What would your advice be for us who are having a hard time, getting the stuff that we used to buy and not necessarily think twice of? Do we just need to change our habits?
Yes. If you're doing the same thing than a year ago, you're losing money. So if I were in Montreal, I would pick 3 stores, big box stores, a specialty store, and a regular grocery store, and alternate between them over 3 weeks every time. Go to a different store. Get educated about the market and prices. Secondly, check your grocery receipt. 1 out of 5 times, there's a mistake there. If there is a mistake there before you leave the store, that grocer will owe you that product for free if it's less than $10.
I have one last question because we're out of time here, and I'm curious. We don't live in a vacuum here. We don't talk about what's going on in other places. You mentioned about this being a global issue. From what you've seen or what you know, let's take the U.S. Are they seeing the same thing here with relation to food costs that we are?
So right now, our food inflation rate is at 10.3%. Theirs is at 10.6.
So it's even worse. Mm-hmm. Okay.
It's even worse. Yes, absolutely.
Sylvain, listen, it's great talking to you. Always. Very much appreciated. Thanks for the insight here. Sylvain CHARLEBOIS over at Dalhousie University, the food professor. Prices are going up. And as you said, if you didn't see the story today, beyond Loblaws, beyond Metro and IGA, they all say they're being squeezed, right, by their suppliers. Frito-Lay today announced they're hiking the price of their products by an average of 10% as well.
That's PepsiCo, I think that's what Sylvain was referring to.
A lot more cost involved in this. I didn't know that about the 1 in 5. Did you? Mm-mm. Your bill is wrong 1 in 5 times?
I've certainly noticed that myself, which is why I hate that I have to put my own stuff in the bag because I'm so busy watching because there's always a price mistake. Wow. So I'm watching it at the same time I'm trying to put the stuff in the bag.
See, it's always easier when the only thing you buy is bagged salad and it's $5.99. It's much easier not to get screwed that way.
Asking questions, looking for answers. Here's more of Montreal Now with Aaron Rand and Natasha Hall.
This week, the World Health Organization announced that COVID-19 is still a global health emergency, and they declined to declare the pandemic is over. We asked Dr. VINH, an infectious disease physician, if he agrees with that decision.
We found out from the World Health Organization exactly what the story was going to be as far as COVID-19 being declared, or continued to remain, to be fair, a worldwide pandemic. And I think for a lot of us here, and it's interesting, I heard sort of opinion on both ends today, but we tend to live in a bit of a vacuum here, right? We see things getting better here, and we assume, well, that ought to be enough reason to say, okay, let's move on. Maybe we end up with the same kind of deal we have for the flu, where a yearly vaccine would be enough to deal with it. But we forget, of course, the rest of the world's not doing as well as we are, so perhaps it wasn't much of a surprise to hear the WHO today declare that COVID-19 would continue to be considered a global pandemic. Dr. Donald VINH is an infectious disease physician and medical microbiologist at the MUHC. He's on the line right now. Dr. VINH, thanks for your time this afternoon.
Thanks for having me, Aaron.
I guess I would start by asking you if you were surprised, first of all, that they said what they said, and B, that some people question whether they would.
Well, I'm not sure I'd say I'm delighted, but I am relieved. I mean, I think as you touched on a very key point, which is that the World Health Organization has to look at the planet as a whole, all the countries. And, there are some countries that are still suffering severely from COVID. And even in the countries that are doing quote unquote well, like, Canada and the United States, we're not really doing that well. I mean, we're better off than we were compared to the start of the pandemic, but we still got a ways to go.
And we're about to mark I think in fact today marks the 3rd anniversary, does it not, of when the WHO announced that it was, they didn't use the word pandemic, but I think it was great concern. Here we are 3 years later. How do you feel about where we're at now, Dr. VINH?
Well, at the start of the pandemic, we were drowning. I'd say right now we're still treading water. Mm-hmm. So we're not out of the woods yet, right? I mean, if we still look at the situation in Canada, there's still COVID infections that are happening that that lead or that require medical intervention, whether that means going to a clinic or the emergency room or requiring hospitalizations or ICUs. That is still going on. Yes, we have vaccines, and they are good vaccines, but they're not quite great yet, in the sense that we need to, have them updated and get booster doses more often than we're used to with other vaccines. And what the unfortunate part of the situation here is that there are continuous emergence of variants, right? So unlike any other infections that we're used to, we're basically dealing with a new form of the pathogen on a regular basis several times a year. You put all that together and you can say, we're really not out of the woods yet.
I want to ask a follow-up, though, with respect to that. When I hear the idea of variants, and we know there have been so many up until now, from a virus point of view, if you will, is there like a timeline on how long this goes on? I think of the flu, and every year there's a different variation of the flu, but we have a vaccine for it. Is that where we eventually head with this, do you think?
Well, I have to be honest with you. I think the answer is we don't know. At the start of the pandemic, we always thought, listen, given the genome size of this virus, there's only so many mutations this thing is going to have before it either kills itself or achieves stability, right? And unfortunately, we've been wrong. We continue to encounter a range of variants that defy what we would have thought could occur genomically. Now, to be fair, not every variant merits any increase in attention. So that there will be an increase in the number of variants. It doesn't necessarily mean that we need to change our strategy. But our current strategy right now is not great, right? We have public health measures that are essentially lacking. We have no improvement in ventilation. We are dependent on a vaccine that has a finite window of opportunity or period where it confers immunity. And we have limited drugs that are available for severe disease. So what we're really, things are better, but they're not great.
My apologies for asking a very loaded question, but if we were to go back in time and say when you thought we would be done with this, did you think that at this stage of the game we would be done with the pandemic, Dr. Vin?
I'm going to be honest with you. I don't know, right? Because the only lesson that we had was to compare back to the 1918 pandemic flu, where for some reason there's been some sort of revisionist history, and we said, well, okay, after a few years, the pandemic ended. But in fact, that's actually not what happened, right? The flu strains that we deal with now on a seasonal basis are actually descendants of that pandemic flu. So that pandemic really never ended. It just achieved seasonality. What we're hoping is that at some point, either through better research or through luck of the draw, if you will, that this virus will achieve seasonality. But so far, it hasn't shown signs of that.
All right, so let me ask a question because it's interesting to reference back to the Spanish flu. So we're talking roughly 100 years ago. All the things we learned from that, here we are 100 years later, and I realize it's unfair to say we didn't handle this as best we could, but we're dealing with something brand new. If you could go back in time, to Natasha's point, what would you have done? What should we have done differently to mitigate this?
I'm going to be honest with you. I don't think that there's any one thing that we could have done. Obviously, we would, what the ideal utopian world is that the entire world would have, homogeneously implemented public health measures to try and get, this virus essentially controlled or eradicated. Realistically, that wasn't going to happen. There's too many, factors as to why that couldn't happen. And on the other hand, however, what we kind of did is shot ourselves in the foot because a lot of places got fed up with the virus and sort of loosened public health measures, in retrospect, very prematurely, and that only led to the perpetuation of the problem rather than a resolution of it.
I was thinking that's why so many people were expecting the WHO today to say, oh, it's over, and it's really not, because they weren't interested in the actual scientific medical side of things. They're just fed up, right? And that has played a huge role. Rather than looking back now, though, I'd like to take a look forward, Dr. Vin, in terms of, the situation elsewhere around the world. Like you said, we're faring relatively well here for the moment, but we've always looked there to see what's going to be headed here. Does that mean we're in for yet another rough ride?
Well, it's certainly hard to know, but even in this country where things are quote unquote going well, we have to remember that with the emergence of variants, this has actually led to a loss of treatments available, right? So every time we used to have a category of drugs called monoclonal antibodies that we could use as one tool against the virus. Every time we've had a variant, the monoclonal antibody arm has gotten shut down. The ones that we used became essentially futile. That tells you that we're still dealing with a problem now. Globally, of course, this is going to be a major issue because, we really only have a couple of antivirals that are available to us. In terms of vaccines, we really don't have equitable distribution of good vaccines across the world. So this is going to put us in a situation where infections will continue, people will continue to get sick, people continue to travel, people will continue to transmit. So we have to make sure that at some point we do at least do the basic measures that we can to prevent infection, and that's not through vaccinations and antivirals, although those are important for disease. To prevent infection, you really need to make indoor spaces safer.
Can I ask, when I started the conversation, I said, we tend to live in a bit of a vacuum here, understandably. We look in our own backyard, we look to the U.S. and see what's going on there, and that's pretty much, the extent of our reach. What's going on as far as the rest of the world goes with COVID right now? Is it out of control in some places?
We think things are going well in the U.S., but they're not, right? If you look at their weekly mortality rate, it's quite high. It's somewhere between 2,800 to 4,000, depending on the week that you're looking at. That's, 1 or 2 magnitudes greater than, weekly cancer deaths. So I think that we have to remember that even in the U.S., things are not going great. In parts of the world, what we've seen, of course, with China and other parts of Asia, is that when you have a loosening of public health measures, you're getting a lot of people who are sick and hospitalized and dying. And so that tells you that the variants that are circulating right now are not benign. And so, I'm glad that the WHO still has that measure in place.
Dr. Vin, as we're speaking, even we're getting texts with people saying, just that they're done and they don't want to hear about it anymore. I feel like I'd like to hear from you. Yeah. What do you say to people?
How frustrating is that for you?
Yeah.
Well, I think we have to understand that, the public and even the medical community is also fed up with COVID. Yeah, that doesn't mean that we actually pretend it doesn't exist, right? And we also have to make a distinction between, it's not black and white. It's not, emergency, measures, all hands on deck, or, apathy. Because that's right now what we're talking about, right? People think, oh my God, we had to do that lockdown. That was one extreme measure. And now we are dealing with apathy, which is the other extreme measure. I think what we need, instead of black and white, we need to have levels of gray depending on, what's pertinent to you. So for governments, this has got to remain a priority. For the medical and scientific community, it remains a priority. For the public, it can't be something that we just ignore. I'm fed up. I'm going to do my own thing, because the reality is that it's the public who continue to get infected, right? It's the public who continues to require medical care. It's the public who requires a healthcare system to take care of them when they do. And despite our measure, we're not always successful. So in helping people who are sick. So I think that people have to realize that they don't have to panic. They don't have to live in a state of anxiety, but they do have to realize that this remains a priority.
Dr. Vin, I want to thank you so much for your time. Always love to hear what you have to say about this. Thanks again.
Thank you very much.
Dr. Donald Vin over at the MUHC, talking about the World Health Organization right now and their decision to continue to call this a global pandemic.
Yes, I really liked what he said there. We don't have to live in a state of panic, but we can't ignore it either.
Just need to be aware.
The stories in the news that are worth your time. Montreal Now with Aaron Rand and Natasha Hall.
A group of Americans have decided to open a Montreal-themed restaurant in, of all places, Washington, D.C., and it's proving to be a huge hit. We'll talk to the principals about why they did it and what exactly a Montreal-themed restaurant actually is. Came across a story this morning and thought, this is too much. Plus, I knew nothing about this. So there are some great Montreal chefs, obviously. They have opened up in different places around the world. I don't know if I mentioned this, by the way, speaking of great restaurants. Montreal restaurant Milos has just opened up in Dubai. So they are out there, but there are other chefs from here, and they've decided to spread their wings, including opening a brand new, I guess we can call it a Montreal-themed restaurant. It is called Le Mont Royal, and it's open now in Washington, D.C.
I'm so curious about this.
Yep, that's the deal. Chaz Jefferson and Bart Hutchins are the owner of the restaurant, and going to go to the phone right now. I'm not sure who we have on the line here. Are you both there?
I'm here.
Yes, we are.
Chaz.
Okay, let's start. Yeah, let's start off, Chaz. Since you're on the line, let me ask you first of all, with respect to where you guys met, how you got together. You both worked in the Montreal restaurant industry, right?
I did not. I think Bart did a stage up there at one point, but both of us were just basically big fans of the Montreal restaurant scene.
Okay, which you discovered what, by visiting here? Because you don't sound like you're from Montreal.
No, we're not. Yes, discovered there by visiting there with other chef friends. It's a not so close-knit secret that Montreal is kind of the mecca of North America for great cuisine. And so I visited there independently of BART, and we kind of came together with our shared love of the city.
So would it be fair to call you guys foodies?
I mean, that's one way to say it. I think like deeply passionate, devoted, sort of religiously devoted to good food might be more accurate.
Wow. Okay. I like that.
Okay. So when you're wanting to bring the essence of Montreal to Washington, D.C., where do you start? And I mean, we need to know a little bit about the decor, and we need to know a little bit about the menu. So let's start with you, Bart. Where do you start from a cuisine point of view to try and capture the essence of Montreal food?
Yeah. So here's the thing. In most of the world, when you say you're going to a French restaurant, what you mean is like you're going to a white tablecloth. It's a Friday night. It's your 40th anniversary, and you had the reservation 6 months ago, and it's this like very stodgy, stuck-up experience. And what I experienced in Montreal was the exact opposite of that. It was just like very casual treatment of classic French cuisine, which is, in my opinion, the best food in the world. It was this very casual treatment of it. I remember very specifically seeing like young men and women like on their way to the nightclub eating kidneys on toast before they did that. And that sort of blew me away and was what inspired us. So on the menu, we're looking at a lot of French classics, bone marrow with escargot. And we're also doing a really killer poutine here, which I don't know where else you would find in America.
Okay, you know, the whole issue with poutine, you got to be very careful, you know, when you talk poutine, right? So are you using cheese curds, the real deal?
We're using cheese curds, the real deal. And we even have a couple of secret ingredients that, and I hope nobody from the FDA is listening, we have people drive all the way up to Quebec to get for us.
Wow. Okay, now I'm impressed.
Okay. And what about the sauce? Does the sauce have that tiny little bit of tang, tiny little bit of, it's not spice, I wouldn't go so far as to say that, but, you know, there's a certain je ne sais quoi in the sauce, Bart.
There is. So the one I'm most inspired by is the poutine and patati patata. And I think we've replicated that pretty closely, but by doing it the hard way. So I take about 24 chickens and 24 ducks and make a sauce out of those, and then add a bunch of things that I can't tell people about, and we get pretty close to what I experienced in Montreal, in my opinion.
Okay,
I'm impressed.
That's impressive. Yeah. Now I should mention as well, beyond it being a restaurant, and I love the fact that you laid it out as, you know what, this can be your night out any night. This doesn't have to be a Friday or Saturday night kind of a place. You're incorporating live DJs and music in here as well, right?
Yes. Yeah, we have a number of vinyl DJs focusing mostly on funk, soul, boogie, disco, to kind of give a unique take on nightlife for Washington, D.C., trying to mirror a number of the scenes that I saw in Montreal and in Paris.
And how are people taking to it? How's the response been?
Well, there's
we've had a line starting around. Yeah, sorry, a line starting at 8:00 that wraps around the block every Friday, Saturday. So
what?
That's crazy. I'm going to obviously guess
people like Canada more than any woman know.
I guess. Obviously, I'm going to guess. You know, again, I don't know how many Montrealers, expats there are in Washington. I imagine there are a few, certainly politically anyway. You get a lot of Montrealers. Do they identify themselves when they show up?
Of course, very, very strongly. Mostly with regards to the poutine, like what we experienced earlier on the radio show. That they're just like, well, I'm from Montreal. I know poutine. Like I look forward to being disappointed by yours, and then their eyes open up wide, and their mind kind of gets blown, and then they get that taste of home here in DC.
Wow. I'm just curious, too, since you mentioned Montreal, and you've eaten here, you've been to a bunch of different places. Do you have smoked meat on the menu anywhere? Is there a plan for that?
We don't have smoked meat yet, but because, and I'll be completely honest with you, because I haven't gotten it exactly right the way I've had it in Montreal, but there is definitely a plan for it going forward.
Okay. And what about I guess there's a couple of obvious ones as far as Montreal goes, right? Smoked meat would be one of them. And I'm trying
bagels?
You asked me about a bagel.
Yeah, I was.
Yeah, of course.
You got those?
No, I'll be honest. I'm not even going to touch the bagel. There's
you're
no trying. I can't do it the way they do it in Montreal.
Great respect for the bagel.
I'd rather die than make a bad imitation.
Okay.
That's probably wise. Now, given that it's been such a big success, Chaz, since you're the owner, why don't you tell me, are you already thinking about other locations? Is this branching out?
Yeah. I mean, we've basically had real estate developers and investors talking to me almost every night that we've been open. So we opened up exactly 3 weeks ago today. A lot of conversations are being had.
I need to also know about the foie gras filled Twinkie. I need an explanation of this, Bart.
Yeah, I mean, so part of my trying to explain Canadian food to an American audience was sort of telling this story of sort of the poor end of people in France moving to Canada and sort of becoming nouveau riche overnight because of the fur trade. And what would happen if you gave a sort of working class American access to foie gras and truffles? Like, I think we would end up seeing a foie gras Twinkie. So what we do is we make a very, I think, accurate replica of the Twinkie pastry, and then we make a Twinkie, then we make a foie gras pastry cream and stuff it inside of it.
Jeez. Where not that it matters, but for people who might be going, where in the Washington area exactly are you?
So we are in Adams Morgan, which is, in my opinion, the most DC neighborhood within the city. It's super diverse. It's got a beautiful density, and it's got a very cool look to it. And so we are kind of located at the top of the hill. That's why the name became very fitting, overlooking the 18th Street, which is the heart of Adams Morgan.
Okay. Do you allow Republicans in?
Allow everyone in.
Oh, okay. Just checking.
It's how they act inside that makes the difference.
Business is business. I need to know. So we pronounce it, obviously, we're going to say Le Mont Royal, but how are Americans saying the name of your restaurant?
Le Mont Royal.
Oh, what?
Without the rolling of the R, they say Le Mont Royal.
Okay.
I'm
we're
impressed.
going to run out of time. Have you had, I'm just kidding, obviously, when asked about Republicans, have you had a lot of politicians show up? I mean, people you would recognize or not?
I don't think we've had, Chaz, correct me if I'm wrong, I don't think we've had any American politicians, but I know about half the Canadian embassy have already been in, for sure. So that's been fun.
Okay.
Which is a lot of people. It's a 300-person embassy. So
that is fantastic,
we've had
guys.
a lot of Canadians.
Where are you guys from originally, if I can ask?
I'm from Charlottesville, Virginia, about 2 hours from Washington, D.C.
That's Chaz.
And Bart's from Florida.
Wow.
And you've opened up a Montreal-themed restaurant in Washington. Of course, it makes perfect sense.
Are you making trips up here on a regular basis for research purposes only, of course?
Only for research purposes, and as many times as we can.
Okay. And just as we let you go, favorite restaurants in Montreal that you have been to? What do you really like up here?
For me, I'm going to go with Restaurant Beba and Auto Bistro.
Beba, okay. Small restaurant in Verdun, I think, right?
Mm-hmm, exactly.
And Restaurant Auto. Friday. And what about you, Bart?
That was Bart.
Oh, that was Bart. Sorry,
Chaz. Chaz here. I love Mont Lapin. That was really one of my favorites. And then we actually have a lot of DC expats down at the Joe Beef group right now. So I love going down and visiting, Joe Beef and Le Vin Papillon.
Okay, cool.
And then, of course, patati patata, although I loved how Bart called it patati patata.
Yeah.
That's the
Potato patata.
Yeah, same difference. Hey, guys, thank you so much for being with us. Chaz Jefferson, Bart Hutchins, owners of Le Mont Royal Restaurant in Washington, D.C., and things are going really, really well. Guys, thanks so much. Best of luck.
Hey, thanks for having
me. Thank you.
You bet. That's this week's edition of The Week That Was on the iHeartRadio Network. I'm Aaron Rand, along with Natasha Hall, and we will see you next week.
Have a fantastic week.
This has been the Montreal Now podcast with Aaron Rand and Natasha Hall. Listen live on your radio weekday afternoons from 2 to 6 on CJAD 800 or through the iHeartRadio app.